thank you for accommodating this meeting of the board. Can I get an approval of the agenda, please? Moved by Councillor Agostino, seconded by Deputy Warden Becchetti. All in favor? Opposed? And that carries. At this time, I'm going to turn it over to Dr. Ken Blanchette, who's going to walk us through the current status of the Consumption and Treatment Services site. And Ken, I don't think we need a motion to approve item number 4. So you know, we'll go through that item. Following that, we'll go right into new business, and then Ken and both Eric and Adeline will present and be available for questions and answers. So, Ken, I'm going to turn it over to you at this time.
All right, thank you, Mr. Chair. Actually, some of this information will also kind of talk to 5.1, if that's okay. It kind of blends in together.
Yep, exactly.
Okay.
Thank you.
So what we're going to do today, I really wanted to provide all of you with some highlights of the information that has been part of some ongoing conversations over the past week. The first element I'd like to be able to share with you is the slide that's up before you right now is some of our local data demonstrating the urgent need for CTS in our community. What you'll see here are the total opioid deaths per annum from 2012 to 2021, as you'll see the increasing trend up to our most recent and highest amount of 86 in 2021. 2022 data is not fully compiled at this time, so that is a projection. But what you will also see within this, these bar graphs and the line graph, especially in the black line, you will see from our epidemiologists have calculated a predictable trend. If a CTS site is not opened in the next few months or in the next few years, you will see as a total of approximately 427 deaths from 2023 to 2026, with an upper confidence level of around 674 and a lower confidence level of around 363. The immediate launch of a CTS could be one of the deciding factors that helps get our area from those upper confidence estimates into a lower confidence estimate. What we'd also like to share is a little bit, beyond outside of our region. From a Canadian perspective and sites across the country, you'll see around 2 million visits recorded at the sites. You will also see around 15,000 overdoses and drug-related medical emergencies that have occurred with no reported fatalities on site. One of the most important things I think that's part of the conversations is really how we are addressing our community concerns. How are they being addressed? And this is an ongoing process, right? Some of the key ones that we have been working on diligently is our safety, security, and crime, our increased congregations of people who use drugs in the area, neighborhood litter, and most importantly, the ongoing dialogue with our residents, businesses, and stakeholders. And that's a process that will continuously occur. As an example, we just recently were provided some data from our local hospital that gave us peak times of overdoses for ER visits. And that is going to allow us to optimize our hours of operation, the way we can conduct business so that we can have the highest level of effectiveness in our community. And that is something that we will endeavor to do for the CTS site location or any CTS site location, wherever it may be located, so that we are always having that continuous feedback and then moving forward from that piece. The next slide. Can everyone see the slides as I'm moving them? I should have asked that earlier. Hello? Can everyone hear me? Oh, okay,
Yeah,
sorry. I didn't have the screens up. I was waiting for a voice. My apologies, everyone. The last slide, or this slide here, we'd like to show you the layout and I guess a little bit of the background behind how this site is constructed and what the purpose of it is to do. So there's been some consultation from a security perspective, from our community partners and medical treatment professionals, from those that would attend and be a part of the site and use the site for their consumption. What's really important about this is the floor plan is unidirectional. It's open sight lines throughout, and it really allows for what's really important in this is an on-site primary care. So they'll be also dealing and providing care for examples of things like foot care, wound care, and vaccinations. It also allows for social service providers that will be there for income and food supports. It also allows for an on-site physician during certain operational hours to provide treatment and clients what they need, and also for referral for addiction treatment services in our community for that continuity of care. And these services are possible by way of the comprehensive layout and detailed floor plans, which accounts for an actual requirement under the CTS application. The last slide that we have for you are recent pictures this week of our current status of the construction of the site. We would like to clarify that a completed retrofit and a renovation of the site is required prior to receiving the federal approval. We're very close to completing the site. We've just also recently been contacted by our federal application partners asking us when we'd like to schedule their site visit for the final approval piece. And we believe we're fairly close to that, within weeks to a month away. So with that, I will stop sharing. And then just as an additional piece in terms of item 5.1, the material that was provided to all of you was material that was provided to our previous board. And as we know, we've had a change in our board. We've had a change to our municipal partners. So we wanted to make sure that everybody had all the exact same information to be able to review as part of this decision. So with that, I will pass it over to you, Mr. Chair, and we are open to any questions.
Thanks, Ken. Can you guys hear me? Yes? Okay, I just had to restart my computer. Sometimes it's as easy as that. Any questions of administration at this time? I'm going to go to my expanded gallery just to make sure I can see everybody, but if you want to use the hand icon as well, that helps. Any questions at this time? I see Rob. Go ahead, Rob, and Councillor Francis after Rob.
Through the chair. Just curious, at this point in time, how much have we spent on this facility in preparation? If it's only going to be a potential temporary, I'm just curious how much we've spent to date and what we intend to spend on completion before we actually open the temporary site, if that's the case.
Okay, I will start that question. I might ask Laurie to add if you want specific numbers on that piece. The construction of the site was actually completed through gapping funds that we had the last fiscal year. So there was no additional tax burden or no additional burden on the taxpayer within our local municipalities. It was close to around 770,000, I think, for completed costs. Is that correct, Laurie? To be able to do the retro.
Sorry, that is inclusive of building occupancy costs for the year. So yes, it's 775.
Yeah. And we do have a signed lease that will carry us through until April of 2025.
Okay, thanks. Thanks, Rob. Councillor Francis and then Councillor Marignani.
Thank you, Chair. Can you hear me okay? My computer was freezing, so I turned off my camera. Okay, thank you. Through you, Chair, to Dr. Blanchette, with respect to the approvals and the expectations, understanding that centers like these are operating across the province, is there any instance where provincial approval was not granted for one of these centers to open across the province of Ontario?
Thank you, Councillor Francis. We have not heard of any provincial applications or federal applications being denied at this point. What we have been able to compile is, on average, it's approximately a year. Some are a little more, some are a little bit less in terms of getting the provincial approval.
Okay, and how far along are we in that? Are we about like halfway there at this point?
Yes, sir. We are anticipating on the average a year approval would be approximately around July. And we have accounted for that piece in the planning of this process.
Thank you. Thank you, Chair.
Thank you, Councillor. Councillor Marignani.
Just a question on the site plan. Just to confirm, the entrance and exit of this facility is on the eastern side of this facility. Is that correct?
Yes, that is correct. That was designed that way so that those that would use the site would enter through the parking lot and not on the sidewalk or the street corner.
Very good.
So they will enter and exit through the parking lot portion.
Very good. Thank you. Thank you.
Thank you, Councillor. Any other questions on items 4 or 5 of administration? Okay. Deputy Warden Bichetti.
Thank you, Chair. Just a question for Lori then, just to clarify, between now and say July, while we're waiting for provincial approval, hopefully that's the timeline, we do have sufficient funds internally to carry us to that point. Should we not receive provincial approval, then let's say it goes till October, there may be an ask of the city county at that point, correct?
Thank you. So included in the 2023 budget are a net amount of $226,000 that are covered by both contributions from the province of Ontario and the municipalities. If we were to go beyond July, that anticipated timeline, and if no other dollars were available from any other sources, yes, there would be an additional ask from a budget perspective to the obligated municipalities. And we anticipate that to be roughly, sorry, go ahead.
No, go ahead, sorry.
We estimate that the impact is roughly $315,000.
Thank you. And then in terms of provincial approval, when that does occur, again, it's not if, it's when. I think it's just a timeline that the province has to go through with the checklist, the exhaustive report that the previous board and you know, the reports that are in this agenda. There's over 400 or 500 pages of information here, and they have to go through that and do their due diligence. The provincial funding does kick in at that point. That would be our start of year end in terms of accounting. It's not, there's no retroactive, or once we get to provincial funding, is it retroactive to the gaps that you've put in from January to June, or does it start June moving forward?
No, my understanding, it would be effective on the approval date. I would request that if Eric Nadelin, because he is more closer to the application process, if Eric has anything to add on that point, I would ask that he respond.
Nothing more to add. What you've stated is accurate.
Thank you.
Thank you, Deputy Warden Bichetti. I see Ken's hands up. Is that accurate, Ken?
Yes, it's actually a little bit of an additional statement for Councillor Bichetti's question, if that's okay.
Sure.
Okay. The one thing I would like to add to what Lori's statement was is the team and I have been actively engaged in trying to find other means as well to help fund this during that gap. As recently we were able to procure $160,000 through a provincial fund that has helped ease the burden on the budget from now until July, and we are going to endeavor to look for other grants and other philanthropic needs in preparation, just in case the provincial application is delayed in any manner past July, to really minimize any effect it might have on the taxpayer.
Okay, thanks, Ken. I see Warden McDonald, and then I believe Councillor Francis again, unless that was the old hand.
Thank you, Chair, through you. Just wondering, and maybe I've missed it at some point. Just wondering, Lori, if and when, well, let's just say if a new site is found, can we get out of that lease if it is the contract is till 2025? If not, like what are we looking for? I mean, that would be additional cost to renting a new place. Just wondering. Thank you.
So we'll have to, from my read of the contract, I believe we have the lease secured until the end, till April of 2025. We will certainly review with legal counsel if there's an opportunity to exit that lease, and if there could be a negotiated cancellation. Again, that would be something that we would need to investigate. And in the event that those occupancy costs could not be, we could not exit out of that contract, we would then have to bear those occupancy costs till April 2025.
Any follow-up, Warden? All good? Okay.
I'm good, thanks. Sorry.
No worries. Any other, Councillor Agostino?
when does if we had to give notification to the landlord that we did want to switch to a different location? Usually there's between 4 and 6 months prior notification that we would be doing this. Do we know what date that is in the lease?
It is 6 months prior to April, so roughly that would be around the November 2024 timeframe.
So November 2024.
Yeah.
Thank you.
Okay, any other questions? Okay, seeing none, at this time, do we want to go in camera or do we want to present the draft motion? Ken, I see we have item 6 is the Board of Health discussion decision regarding the city's new notice of motion. So should we provide the draft motion for the board's review at this time, or do you want to go in camera first?
We could review, I think it would be good to review the one document in camera first, and then we can come back into open.
Okay, let's do that then. So I'll need a motion to quickly move in camera, moved by Warden McDonald, second by Councillor Agostino. All in favor, opposed, and that carries. So I
Can everyone see my screen?
Yeah, I can see it, Ken.
Okay.
We just got to wait for Conrad to give us the go ahead.
It'd just be a few more seconds, Mr. Chair. Okay, Mr. Chair, I received notice. We're good.
Thanks, Conrad. So, board members, you were provided this draft motion earlier this morning, and what we'd like to do out of full transparency, so we can have a discussion on this, is you have the motion in front of you. I'll ask either Ken or Eric to just walk us through it. But the motion is essentially the spirit of the compromise that was made on Monday. And so again, I'll ask Ken to walk us through this motion.
Certainly, Mr. Chair. In the first parts, whereas Councillor Agostino from the City of Windsor brought forward this current motion, which was also on their public website. And then whereas the motion from Councillor Agostino was rescinded based on a compromise requiring Retrue Board of Health approval. So with that and the discussions that have occurred, a really good discussions over the past week, we are presenting the following or to the board. Therefore, be it resolved that the Retrue Board of Health move forward with the opening and operation of the current Safe Point site at 101 Wyandotte Street East, once federal approval has been granted, and further that the Retrue transition operations without disruption once provincial approval is received. Therefore, be it resolved that the Retrue will provide the funding required through its operational budget, potential grants, and philanthropic means to fully operate the Safe Point 101 Wyandotte Street East until provincial approval is received, in which sometimes it becomes fully funded under the provincial model and operate. Therefore, be it resolved in preparation for a condition in which the provincial approval is delayed beyond the anticipated timeline of summer 2023, the Retrue will endeavor to further explore and obtain additional funds through grants and philanthropic means that will reduce the municipal monetary requirements beyond what has already been approved in the 2023 Retrue budget. Therefore, be it resolved, the Retrue will support the City of Windsor Councillor Ronaldo Agostino as the appointed chair of the Site Selection Committee with the purpose of determining the location of a new CTS site. The support will remain for the duration of the project until such time a new location is decided and approved by the committee, Retrue's Board of Health, and the City of Windsor under the process decided below. Therefore, be it resolved, the hosting municipality and the Retrue will establish a process for recommendations of approval of the new site with both parties having equal involvement. For greater clarity, the administration from both Retrue and the hosting municipality will work in good faith to establish an equal weighting scale and process to recommend a preferred site amongst a short list of future sites recommended by the Site Selection Committee. Therefore, be it resolved that the Retrue will close the current Safe Point site at 101 Wyandotte Street East once a new location has been selected by the Site Selection Committee, the Retrue Board of Health and the City of Windsor in accordance with the process set above, and the senior level government applications process have been completed and approved, as well as all construction in such new site has been completed in full in order to mitigate any disruption of services to its clients and patients. For further clarity, the Retrue is committed to only one CTS site in the City of Windsor. Therefore, be it resolved, the Retrue requests the City and the County Council to advocate to upper level government for application approvals and funding.
Thanks, Ken. So I'm going to ask that we keep the motion up there for now and ask board members if you have any questions. I think first we'll need a mover and seconder so we can discuss the draft motion. And then I'm going to ask that you raise your hand on the icons because I can't see everybody with the screen share on. So can I get a mover and seconder to discuss this draft motion? Moved by Councillor Marignani and seconded by Councillor Bichetti. All in favor? Opposed, and that carries. Okay, so now any questions on the draft motion? Okay, Deputy Warden Bichetti.
Thank you, Chair. I don't know if it's a friendly amendment. If we can add at the last paragraph where it says, therefore be resolved, right at the end of the period and funding, and if we can add an and, a letter be sent to the Minister of Health, Sylvia Jones, Associate Minister of Mental Health and Addictus, Minister Tabolo, and our local MPPs, Andrew Dowie, Lisa Gretzky, Anthony Liardi, and Trevor Jones. Those are our provincial reps, and I think that's part of their job is to lobby on top of the city and county obligations that we have as elected officials. I'd like them to be aware and also to develop a paper trail so that we could follow up with the province that, look, we're seeking funding in whatever letters crafted by the health unit. I think if we add that, I think it'd be nice if we could fire off that letter sooner rather than later.
Thank you, Deputy Warden. Is that friendly to Councillor Marignani, the mover, and is that friendly, Councillor?
Yes, that is friendly and that is wise. Very good add, Joe. Thank you.
Okay, so we have a motion on the floor. I think what I'm going to do at this time is Ken, if we could get out of the screen share. If folks have questions regarding specific sections of the motion, they have, you all should have the motion on your iPads. So, and if you don't have access to that, let us know and we can share the screen again, but I think it's important that we see each other on this. Now, any other questions on the draft motion? Okay, seeing none, I need, Warden McDonald, yes.
I'm just making an assumption here that it's fine with the city, because to me as county, well, yes, we choose board members, but this is in your bailiwick, for lack of a better word. And certainly I know there's been consult with the health unit and Dr. Blanchette. So I can certainly not speak against this at all. You have my support, and I'm assuming by the silence from the Windsor board members that this is fine. So on our end, we're happy that we can find a compromise, and I believe was Dr. Blanchette said earlier, it's about working together and finding something that's palatable. Again, I feel like from the county, we couldn't speak against what you were saying, first of all, because, well, I'm new, but also with Deputy Warden Bichetti and I, it's not our citizens that are complaining. So whatever we have to do to support, to see that this goes through, because it's for the benefit of the whole, we will support and leave the details to you as the people who have it in your backyard, and then to the professional health people. So anyway, I just wanted to say that I've tried to be quiet because I don't feel like I should be weighing in on something that is impacting you directly, but know that we support you and we are about finding compromises that are for the greater good, still keeping in mind the ripple effect in our community. So that's all I wanted to say. Thank you.
Thanks, Warden, and I really appreciate those comments. I think in the spirit of collaboration and compromise, I think we've worked together on trying to find a solution here, and you've really said it so eloquently. We want to make sure that the city and the county and the health unit in the city and the health unit in the county have good relationships, moving forward, of course, right? So I see Deputy Warden Bichetti. Is your hand intentionally up? No. Okay, Councillor Francis.
Thank you, Chair, and thank you, Warden, for those comments. Chair, I don't know if we're in questions or comments, but this is more of a question rather than a comment. This motion did not pop up overnight out of nowhere. There's been significant discussion with the Chair, Councillor Agostino, and Dr. Blanchette pretty much throughout the whole week. And this is kind of what we settled in on, that we're comfortable with. I know Councillor Marignani is comfortable with it. I'm comfortable with it. I'm prepared to support it. I fully expect and hope that it's a unanimous show of support from the Health Unit Board today. And then I'll go back to City Council. And then I would think it would receive majority support there as well at the next council meeting as discussed on Monday. But yeah, based on the silence and the lack of questions, I don't want anyone to think that This has been a surprise, and it's, and I'll turn this over to the chair, Councilor Ronaldo and Dr. Blanchette. One day, I'm sure there'll be a book written about this in this week, in the countless hours. Ken's laughing already. Countless hours, the going back and forth, the negotiations have really been detailed, and a lot of sweat equity has been put into this. And this is kind of why we're here. So, I said it before, and I'll say it again publicly. At this point, I'm almost convinced that Councilor Agostino might be the smartest guy in the room to essentially bring us to this point to get a compromise that many of us thought we would never be able to reach. So again, I just want to give credit to Dr. Blanchette, give credit to Councilor Agostino, and give credit to Councilor Costante for being willing to listen, being willing to compromise, and getting us to a point where, again, I hope this is a unanimous show of support. I'm supporting it, and I think we can move forward in a positive way when many thought we could never potentially get to this point. Make no mistake of it. This motion is, and this compromise is not a perfect compromise for everybody, but I think everyone's willing to give a little bit and really go out there on a leap of faith and trust that this is the right thing to do, and that trust everyone's going to fulfill their end of the obligation. So based on that, and in the discussions I've had with everyone over the last week, I'm fully ready to support this.
Thanks, Councillor. Really well said. Councillor Marignani.
Yeah, I just wanted to say that as far as this concern that we have for this site, this is really just the smoke of what we're dealing with and not truly the fire. So it's a much bigger picture that we have to really focus on as a committee in order to truly curb this concern that we have in our society. And like any sort of condition, if it's not treated, it spreads. So it can become a county problem. It can become a wider issue. And I'm proud to see that we're all taking a stand and trying to improve that situation for our city and for our citizens. And I'm happy to see the support that we get from both our county and our city. Thank you.
Thank you, Councillor. Deputy Mayor Shepley.
Through the chair, and again, I want to echo Madam Warden's comments. If this is what the city wants, I think we will support it. Being new, I've done a lot of research in the last couple of weeks, reading up on this, trying to get caught up and understand. And I think that they're probably correct. This isn't probably the best site for this. However, we've gotten this far along and spent the money we spent. It's unfortunate it couldn't have gone to a better permanent location, but I'll support it based on where we're at and where we want to go.
Thank you, Deputy Mayor. Councillor Agostino.
First of all, I want to echo the chair's comments and say how proud I am of this council, of the members who have been, Councillor Francis, the leadership, Councillor Costante, the leadership, Ken, Dr. Blanchette, the leadership of everyone being able to get into a room and say, let's figure this out. And I know it's a little bit unheard of, but it worked. I think there's one thing that I wanted to make clear from day one, and sometimes it gets lost in the trees, is that I've always been in fully support of a CTS site of SafePoint for downtown Windsor. There's never been a question of that. What this has brought to the table, what this conversation did, is it opened my eyes to see that there's a lot of people that didn't want to talk about whether this was the right location for SafePoint. The conversation quickly turned to, should we have a SafePoint? Which in my mind says one thing: whether you support the site, whether you don't support the site, or whether you support having any site at all, there's one thing we all share in common. We all are scared. We're all scared. No one has the crystal ball. No one can see into the future. And everyone is scared. And that's what we all have in common. And the agreement, the negotiation, the compromise we've come to together today does a lot to help mitigate those fears for everyone. And I'm so proud of everyone here on this team. And I'm so happy that we were able to come to this compromise. And I look forward to the future of trying to help people over the next 4 years as best as we can. Thank you.
Thank you, Councillor. Also very, very well said. Ken, I see your hand up.
I figured I'd be the last one to round it up. As Councillor Francis said, we spent a lot of time in conversation. And I kind of chuckled because, we've had a lot of great conversations over the past week. Few laughs along the way too. We gotten to know one another. But most importantly, and I really want to reiterate this to the board and to the community that's watching, at no point was there ever a question about saving lives. That was the mission that brought us all together. And from my perspective, you can always work around that. And that's what's gotten us here today. Openness, great conversation. We've talked about a lot of difficult topics together, and yet we've landed here, and I think we're going to be better for it. The community is going to be better for it. And this is probably the biggest decision that any of us have had to ever make in our life, is that we are saving this many lives. So well done. It actually has been a pleasure working with you guys on this, and I'm looking forward to at least your entire terms in politics and hopefully longer, and enjoying some more collaborations and partnerships together.
Thanks, Ken. Any other comments or, I guess, questions from the board? So I'll just echo the sentiment. Let me say that in negotiations and compromise, you're in a good place when everyone is equally dissatisfied, with the outcome. And I think to a large degree, we're all kind of equally dissatisfied to an extent. But again, those are the markings of a good compromise. And it's also a great way to set the tone as we move forward. I think this is a really good opportunity for us to think about the way we do work, think about the way we compromise, the way we collaborate. To Councillor Francis's point and Councillor Agostino's point, we're doing something that is different, this time around, and I think, I look forward to more of this. I look forward to a strong relationship amongst the city and the county, a strong relationship amongst the health unit and the city and health unit in the county, and all parties that are involved, not just in this process, but in the regular business of the health unit moving forward. And so, this is a really good exercise in what they call sausage making. It was very difficult. We went through a lot of ebbs and flows, but we got to a place where we can all live with it. And now the hope is that we all rally behind this process, not just opening up the site at 101 Wyandotte, but supporting Councillor Agostino in his effort to lead us to find a new location. And so with all that said, I just want to thank everybody that's been involved in this process, the long hours of work that were involved, and your commitment to public health in our community. So with that, I'd just like to call the question on the motion. It's been moved and seconded. All in favor? Are there any opposed? Okay, seeing none, and that carries unanimously. I think I just need a motion, unless anyone has any questions or comments, a motion to adjourn.
Motion to
Moved
adjourn.
by Councillor Marignani, seconded by Mayor Prue. All in favor? Opposed? And that carries. Thanks, everybody. Thank you.
Thank you.